everyone. Thanks for making it today. My name is Stephanie,
And my name is Terry.
And my name is Brianna.
and we're pharmacy students from Oregon State's College of Pharmacy, and we're here on behalf of Operation OTC Med Safety. And so, again, we're from OSU's College of Pharmacy, and our goal is to help ensure that people have the skills and the knowledge to safely use their medications, make some healthy decision making, and also, and so today we're going to talk about fevers and colds and what over-the-counter medications you can use for that.
Okay, so the National Institutes of Health, which is the NIH, says that Americans catch 1 billion colds per year, and as many as 20% of Americans get the flu. So 7 in 10 Americans actually use over-the-counter medications to treat cold and flu symptoms every year. So we do use our OTC medications a lot.
So today we will be talking about fever versus cold. For fevers is when your body temperature is higher than normal. Fevers don't usually show up by themselves. They usually appear because your body is fighting an infection. For example, if you have flu, chickenpox, or pneumonia, you're more likely to be associated with having a fever. The normal body temperature is 98.6 degrees Fahrenheit, and so temperatures over 99.7 degrees are considered a fever. On the other hand, colds is when various viruses infect the nose and throat. Symptoms include runny nose, sneezing, and congestion. Fevers are not usually associated with colds. However, it is important to note that children are more likely to have a fever with a cold.
Okay, so the old over-the-counter medications for fevers are called antipyretics. And so how do they work? So what they do is they stop the production of prostaglandins, which control the processes in your body, like inflammation. So, that's when your body works harder to fight off the infection and your body starts to heat up. And so taking these medications will help lower your body temperature. And you might also know them as painkillers that help with things like headaches, and they can come in a liquid or a pill form.
So, fever treatment, pharmacological treatment for a fever, which is with the use of medicine. For adults and children over 12 years old, ibuprofen or acetaminophen, which is Tylenol. Ibuprofen is actually found to be more effective for reducing fevers, and it can be a little different for everyone based on your age and things like that. So, you just want to carefully read the dosing instructions that are going to be on the back of the bottle or the box for each different medication. Non-pharmacological treatment, which is without using medicine, you want to also drink plenty of fluids and get plenty of rest. Cold compresses, such as a cool rag on your forehead. You can run a tepid bath, which is just lukewarm, moderately warm water. And then these are some examples of what Tylenol and ibuprofen would look like. The Aleve is also naproxen, actually, which is kind of like ibuprofen, but they just come in a lot of different bottles and a lot of different forms.
And then for a cold treatment, the pharmacological treatment. So for a cold treatment, you kind of want to focus on the symptoms of a cold. So today we will be talking about congestion, which is a common symptom of a cold. For this one, for adults and children over the age of 12, you can use oxymetazoline, which is a nasal spray, and that helps with congestion. That one can be used up to 3 days. And then phenylephrine is another medication that can help with congestion. It is important to note, though, that these medications often come in combination with other medications. And then for a non-pharmacological treatment, which means without the use of medication, you should have plenty of fluids and rest, which is common with fever treatment as well. Nutritious diet as tolerated. This just means you have a healthy diet as possible when you have a cold. Humidifiers can help to provide moisture in the air. And then proper hand hygiene. Make sure you wash your hands with soap and water for at least 20 seconds. This can help prevent the transmission of bacteria and viruses. Vitamin C and zinc supplement can also be used for treatment of cold.
Okay, so what we call the things that help you with like stuffy nose and runny noses are decongestants. So how do they work? So the decongestants help the blood vessels in your nose to constrict or shrink because whenever you get a cold, um, the blood vessels in your nose will swell up. And so they'll block any fluid from coming out, making it really difficult to breathe. And so it'll help with the swelling in like your nose cavity. And these usually come in a liquid form, a pill form, or a nasal spray. And so these are just some examples again. So we have Dayquil. Just know a lot of these cold products come in combination with like flu products. So if you see on the Dayquil, um, there's acetaminophen, which is also called Tylenol, which we talked about earlier, that helps with fevers. And then also phenylephrine, which is one of the decongestants that we talked about. In the middle, we have this Afrin, which is one of the nasal sprays that we talked about. And then to the very right, it's just it's just phenylephrine, which is also used for decongestion.
Okay, so here's just a question for you to think about, maybe help you with reading labels. This is Delsum, and maybe do you know what this is used for? Is it used for a fever or a cough? If you look on the label here, there's a little hint. The arrow is pointing to the active ingredient, which is dextromethorphan. And then if you look over to the right further under purpose, it'll tell you. So it is used for a cough, which can often be a symptom of a cold. Why is it used for a cough? It helps in reducing your cough. And then if a patient has a cold without a cough, you will not want to use this medication because it won't help you. It's only for helping a cough. Also, a lot of products have something called doxylamine succinate in it. It's an antihistamine. It is used as a sleep aid. That's why it's in a lot of cold products because you need lots of rest to get better. This ingredient can be found in a lot of different cold medicine products. Because it makes you sleepy, it's found in NyQuil, but not Dayquil. It is in cold products because it helps you with sneezing, runny nose, and a stuffy nose, which we called congestion. But you do want to avoid taking this during the day because it can make you really drowsy.
So this is a bottle of Trojan's acetaminophen, also known as Tylenol. What do you think this is used for? A fever or a cold? It's for a fever. Why? It's because the active ingredient acetaminophen is used as an antipyretic, which is also known to lower fever. So antipyretic just means to reduce like the heat, so fever. It should be noted that it can also be used for headache and body ache, which may be associated with colds.
Okay, and then one more question for you guys. So we have a glass of water and we have someone sleeping peacefully in their bed. So does anyone know what drinking lots of fluids and getting a lot of bed rest is good for, fever or cold? And if you want to, you can put it in the your answer in the chat. Okay, we'll just go on to the next slide. It's just for both. So for both fevers and colds, you want to drink plenty of water, plenty of fluids, and get plenty of rest in order to help your body recover. And then just a quick note for you guys, you should definitely see your doctor if your fever reaches to 103 or over. That can be a pretty serious one, and it's not it's best for someone else to help you treat your fever. Or if your fever has lasted for over 3 days, that might mean that something else is going on. You should definitely see your doctor about it. And with these medications, always have your parent or your guardian help you with taking these medications to treat yourself at home. And if you or your parent has any questions about these, there's always a pharmacist around who's more than happy to answer your questions.
So, just for fun, there's some crazy ways that we actually used to treat the flu that we don't use anymore because we found out they don't really work. People actually used to wear red because they believed that the flu did not like it, so they would not get infected with the flu. If someone in their household had the flu, people would actually slice onions and put them around the house because they believed it would absorb the virus and keep anybody else from getting it. Bloodletting, which is also just it's a fancy word for draining a bunch of blood from the body. And they would do this because they thought if they drained a bunch of blood out of the body, then it would get rid of all the toxins that were making them sick. This actually killed a lot of people when they used to use it, and it even contributed to the death of George Washington. Laxatives were also used for the same reason as bloodletting because they thought that would get rid of all the toxins that were making them sick. But actually, a lot of the laxatives that they used were made of toxic substances, so it still made them sick. Whiskey was also used for pain, but it just alcohol disrupts sleep, and your body really needs sleep. And then you don't want to mix alcohol with medications. So even though some people feel like it does help with pain, it's just really not a good idea and not a useful way to treat any of your symptoms.
So there are multiple career opportunities within this field. There is an epidemiologist, which is a scientist who studies diseases in humans. They are also known as disease detectives, where they gather information about how the disease started and then make recommendations on how to stop and prevent future outbreaks. This is very analogous to what is happening today with the COVID-19 pandemic. Epidemiologists are working very hard to gather information, make recommendations, and that's why you see a lot about the mask mandates and then the COVID vaccine for the push for those today. For this career, you would need a bachelor's degree in a related field. This could be biology or public health, and then a master's degree in epidemiology. If you want more information, you can click on the link there. And then pharmacists. This is what we all are working towards right now. So these are people who are medication specialists who ensure that people are using their medications safely. They work in a wide range of places, including hospitals, poison control, drugstores, can be like Walmart, Fred Meyer's, all of those grocery stores that you would typically go to. A bachelor's degree is needed, and then a doctor of pharmacy, which is what we are all working on right now. You can go to this website for more information. And then if you have any questions related to the career opportunities or this presentation in general, feel free to email us at precollege@oregonstate.edu. And we thank you for taking the time to listen to our presentation and being present. Thank you.